Hello everyone. Hi. Okay, so today's session is about sciatica, and we have Dr. Vidhi with us. She will be joining us shortly. Dr. Vidhi is a PT postnatal antenatal expert. She also happens to be our school friend. A really special session. Hi, Raksha. So we will just have her join us.
Hey,
Hi, Vidya.
hi.
Yeah. So while we wait for Dr. Vidhi, I will just give you all some description about New Mother, what we do. Thank you
Hi,
so much,
ma'am.
Divya. Thank you so much. Yeah. So New Mother, we have courses which help pregnant women uh, to prepare for their postpartum period. Uh, you know what really happens. Yeah, hi Raksha. You can type it in comments. Hey, hi Vidhi.
Hi.
You are there. Can you please send a request to join? Raksha, you can drop us a comment regarding whatever you want to tell. Hi. Yeah, Vidhi. Let me just get in Vidhi, Vidya, okay?
Yeah, yeah.
Yeah, I'll just add her. Okay.
Yep. Now
Okay.
you,
Hey, Vidhi is here.
Hey,
yeah,
Hey,
hi.
hi Vidhi.
yeah. I was here long back, but only thing is I couldn't join in
Okay.
properly. I mean, I didn't know I had to send a request.
Okay.
Oh,
No issue.
So how are you guys?
We
yeah,
are
so
doing
nice
great
to
for you.
and so nice to see you.
All fine.
Yeah.
Same here.
Yeah, so I already introduced you, Dr. Vidhi. If you would like to say a few words about yourself, something nice, you can please go ahead.
I'm a physiotherapist. My name is Vidhi Gimawat, and I'm an antenatal and postnatal specialist, and more so working on the pelvic floor muscles and getting awareness among the masses about urinary incontinence. That is what I'm working right now on. Apart from that, I am practicing in Kandivali. So if you have anything, just let me know.
Yeah, definitely.
Thank you
Thank you
for
so
that
much.
lovely introduction, Vidhi. Okay, we have been getting a lot of comments in this live session itself. It's somebody called Your Basic Dash. If you can DM us, we should be able to answer your question because this particular session is particularly about the sciatica nerve, and we are going to remain on that topic. And we can, if you can DM us, it would be great. You can send us a message, and we will get back to you. Yeah. Okay. Okay, Vidhi. So starting with our first question. Yeah.
Yeah.
So when, I had some stories posted today about sciatica. Okay, and it so happens that many people are not even aware about sciatica, what it is. So let us start with the most basic thing, like what is sciatica and how it is crucial, why it is crucial, and why are we talking about it? Like, why is this one complete topic?
Yeah. Okay, so I'll just tell you sciatica in common and not particularly with the reference to a pregnant
Okay.
female. So sciatica is basically you have pain in your back, you have pain in your buttocks, your outer legs, and it goes all the way up to ankle. So what exactly happens is you have your spinal cord and you have the nerves coming out. So those are the nerve roots. Basically, they are not nerves; they are nerve roots. So there is a combination of these roots which form the sciatica nerve. So in case of sciatica nerve, it is L3, 4, 5, S1, 2. So these are the five roots which join in and they form the sciatic nerve. So there is a small canal. I wish I had that vertebral column. I could have told you. So there is a small canal from where the sciatic nerve passes and enters into your
Okay.
buttocks. So at that canal, when it is compressed due to a disc bulge or a spasm in the muscles, or there is a stenosis, or there is a spondylolisthesis where one vertebra moves over the other, so that space reduces. When that space reduces, the nerve gets irritated. Initially you will have only sensory symptoms. Now we are talking why it is important, because it can give a hell lot
Yeah.
of pain. You will not be able to sleep at nights, and if the case worsens, you will start having foot drop. That is, you hold your foot exactly like this, but when you have the sciatic nerve involved, and when it is in the higher stages, and if there is the motor component involved, we say the nerve is two components, sensory and the motor. So initially we have the sensory component involved, so that will cause a lot of pain, tingling, numbness. You feel ants are crawling over your legs, so those sensations you will feel. Once, if that is not treated, and if it becomes more severe, then it goes towards the motor component, wherein the muscles of your leg lose its power, because those muscles are supplied by your sciatic nerve. So once the motor component is involved, you will start having weakness in your foot, and finally you will have a foot drop. So then that will create a lot of problems, because you won't be able to walk properly. Your foot is hanging, so you will compensate it by folding your knee more while walking, and it becomes a very uncomfortable thing. And what people don't know is 90% of the cases sciatica can be treated. People don't know. People are like, "Arey, mere ko sciatica ho gaya. Now it cannot be treated. I have to live with that pain forever." These are the stories what I get to hear in my normal practice. So I need to actually tell them, see, 90% of the time sciatica can be treated. You just need to follow what instructions are given, what exercises are given, and it will take a little time to heal, but it will come down.
Yeah.
So I think that is what I've told about sciatica a lot.
Yeah,
Yeah,
actually,
thank you
my
so
mother
much.
had it.
Well, thank you so much for that, Vidya.
Okay.
It was a very detailed explanation. Thank you. Yeah, Vidya.
Yeah,
Yeah.
no, could you tell about, could you just explain about foot drop? What is that foot dropping?
See, foot drop, what happens is sciatica nerve, it enters through your buttocks and then into your thigh and into your leg. So it is supplying the major muscles of you have this is your foot, okay? So when you walk, you are taking it like this and you are keeping it like this, okay? Now when you have foot drop, it is fallen like this. Your ankle basically is fallen like
Okay.
this. Now if you have to lift this ankle, you are going to use, suppose this is your knee. So you are going to use this knee and keep it down.
Right.
This is going to remain fallen.
Yeah. Actually, my mother. Yeah, I got it. Actually, no, I'm picturing my mother. She had it, and it was for, yeah, and it comes only for one leg. The nerve pain. The way she used to walk.
Yeah.
Now she's okay. As you said, it was treated because of, various exercise. She also had to go through physiotherapy. But it is a very painful period. Very, very painful. Yeah.
Yeah, definitely.
Yeah. And what are the symptoms we have to look out for in the initial stages itself?
See, initially, no, you will have pain in your back. You will have normally sciatica happens because of a disc. Major cases, it is because of a disc prolapse, or if the vertebrae move one above the other. So these are more of a sudden things. Apart from that, you have because of aging, there are bone growths, bone spurs, all those things are there. So apart from that, if it is like a disc prolapse, so it will be sudden. You will not have any symptoms. Like you lift something, there is a disc prolapse, and you've got the symptoms. Otherwise, if it is like slowly aging, then you will have back pain, you will have buttocks pain, you will feel something crawling on your legs. So these are the very initial signs. So you have to take care. Now, with regard to pregnancy, what happens is in pregnancy, a lot of weight is over the front of your body, that is your abdomen. So because of that, your center of gravity is shifting. When your center of gravity shifts, the body tries to align it back to its normal position, because COG has to be in the normal axis of your body. So what happens is your back curves. The lumbar part, it curves. So that is why we have that posture. And when that curves, a lot of stress is on your spine. And apart from that, you have the hormones which are causing a lot of ligament laxity. So overall, the spine is very unstable, and instability is more at the lumbar spine.
Okay.
So at that time, the canal can, the canal space reduces, and because of that, a lot of pregnant female feel that sciatic pain, which is very temporary. Once they deliver, rest, and once they are around 2-3 months, normally it goes away. The pain goes away. When there is pain, just visit a physio. They'll teach you how to stretch when you are pregnant. See, a normal person stretching and a pregnant female is different. So visit a physio. They will teach you how to stretch and a few basic exercises what you can do at that time to reduce your pain. So we just focus mainly on reducing pain in pregnant females.
Okay.
Yeah, so
So that
basically, with you saying that, like, if at all a pregnant woman experiences any of these symptoms, the best strategy is to visit a physiotherapist or consult a physiotherapist, right? Is there anything
yeah,
that, you know,
because
it can be done at home, some kind of home remedies or anything? Is there anything like that?
you can use hot and cold packs. Hot packs and cold packs. I normally tell them to use hot packs, but some people know they do not relieve with hot packs. So then I tell them use alternate hot and cold.
Okay.
So it is like 10 minutes of ice pack, then 10 minutes of heat therapy, then again 10 minutes of ice pack and 10 minutes of heat therapy. So what happens is the hot packs will reduce the muscle spasm. So muscles are relaxing, and the cold pack is reducing the swelling if there is any inflammation. Normally there is a little inflammation when your canal is size is reduced and the nerve is getting impinged. So there is inflammation, a little bit of it. So it will reduce the inflammation. So either way, a contrast therapy, we tell it as contrast therapy, that will help more to reduce your pain symptoms. Apart from that, stretching, once you go and learn it from a physio, then you can do it at home. We teach you self stretching, so you can do it at home.
Okay.
You don't need to visit the physio every day.
Okay, regarding the ice and cold pack, ice pack application and the heat pack application. So, like, where do you like where whichever part is paining, the person has to do it over there, right?
Normally they will have pain at the back and over the buttocks. So pregnant female normally will have pain over there, and the pain which is going inside your leg, it is a very sharp pain which goes to your leg. So once you apply your ice and hot packs on your back and buttock, the pain will reduce.
Okay.
So you don't need to go all the way up to your leg.
Okay.
So basically it is the lower back and your buttocks.
Okay.
Yeah, is it like, only one nerve pulling some, I mean, I read it somewhere. While walking, they feel like, only something, one leg, something is pulling. They're not able to walk. Yeah.
Yeah, that is normally what happens is the pain or the pulling or whatever the numbness, irritation, it follows a pattern.
Okay.
We tell it as the dermatomal pattern. So the roots S3, S4, L3, L4, 5, S1, 2, they supply a certain part of your leg. So that part of the leg will feel that sensation. You will not feel it in the front of your thigh or the inner side of your thigh. You will feel more towards the outer and the back side of your thigh and leg, because that is the portion where the nerve is supplying.
Okay. Thank you. Thanks, Vidhi. And you also mentioned that once the baby is born, usually within 2 to 3 months, the pain subsides by itself, right? Yeah, definitely. If it does
Yeah.
not go away, the best thing is to consult a physio. But then, are there any cases wherein the woman has actually not experienced any sciatic pain during the pregnancy, and she actually experienced that after childbirth? Have you seen anything like this?
Yeah, it happens. It is not very common, but it does happen. That is mostly with the females who have had labor and vaginal delivery.
Okay.
So because of the pushing and because of the pressure in the abdomen, there could be some times when there could be a little disc bulge, or something happens in with the mechanics of your spine, and they could start getting that sciatica pain post delivery. So don't worry, that is also that can also be treated.
Okay.
Only thing is you need to follow the instructions and you need to be a little patient. It will not go away in a day or two. It will take a little time to go away. So you need to be a little patient with this.
So Yeah, so basically it is like when so let me ask it in this way. Are there any OTC drugs also prescribed in case a person is experiencing sciatica pain, or it's only about you know uh, therapies?
No. There are drugs which can be prescribed, and I would say better to visit your gynac because you are pregnant. So your gynecologist is the best person who will tell you what drugs you can take and what drugs you cannot take.
Hmm.
Agreed, this is a ortho case. You
Mhm.
need to visit a
Mhm.
orthopedician. So you can, if your gynac says no, you visit a orthopedician. So it is a better this thing. Go to a ortho. He will check you
Hmm.
properly.
And what
So
if
they give you
Gynac does
painkiller.
not
They give
suggest
you
to visit a ortho, Vidhi? That can also happen, right? Like they're just giving some over-the-counter medicines, and then maybe that person is having temporary relief. So what is your
yeah
suggestion?
the
Yeah.
safest the safest option is if your gynac is giving you a painkiller, she knows that what condition you are in, so she can know that which NSAID or whatever drug you are supposed to take. So if she says you don't need to go to ortho, just take this painkiller. So take that painkiller. Have faith in
Hmm.
her. The most important thing is have faith in your gynecologist. She's not going to tell you anything wrong. If the pain doesn't subside even after a week or 10 days, go back to her and tell her, see, the pain has not subsided. Do you want me to go to a ortho or a physio? She will tell you. I mean, the gynecologist is also a doctor. She knows what is going on in your
Hmm.
body.
Right.
So she's the best person to, because we are talking with pregnancy and sciatica, so she is the best person to take a
Yeah.
call.
So basically, like if there are pregnant women who are watching this, because we had some questions today regarding this, that's why I asked this to you. So it's best to first visit your gynecologist, as suggested by Dr. Vidhi. It's not like if you're experiencing some leg pain, you're directly rushing to a physiotherapist. First, visit your gynecologist, have it assessed. She will be
Pain
the
is
right
always
person to
better.
guide you, whether it is really a sciatica pain or it's something else. It can be anything else, right? So visit her, and then accordingly visit the specialist, whichever your gynec recommends. Yeah, Vidhi.
Yeah,
Yeah.
correct.
Actually, the correct me if I'm wrong, Dr. Vidhi. So this pushing
Yeah.
vaginal delivery you were telling, right? It can happen during this. So most of the times or sometimes the pushing is done through pelvic area, but the pushing is not supposed to be done through pelvic area. So maybe can this cause, because pregnant women who are watching should not think that because of vaginal delivery we are going to get sciatica pain. So that's the reason.
No,
Yeah,
no, no,
I'm
no.
yeah.
See, vaginal delivery will not cause sciatica to everyone. See, there is a proper method, the way you
Mm,
push, especially when we teach you that is why antenatal training is very important for a female who is going for a vaginal delivery, because she should know what changes are happening during labor and when I am
right.
pushing. She should know how to push
Mm,
the baby correctly, when to halt, when to
right.
push. All these things she should know it very well. And if she does it very well, then I don't think there'll be any pressure. But see, you cannot
Right.
tell. Every body is different. Even after doing everything correct, there may be something which can cause sciatic
Yeah.
pain. You cannot never tell that. And some people, they don't know anything. They are pushing haphazardly with the pelvis, with this, that, and still they don't
Yeah.
have. So it is all a matter of chance and your body how it reacts.
Right.
Yeah, that's right. I have one more question. Since we're talking about pelvic floor, most women are maybe it's just kind of everywhere in social media. Kegels, pelvic floor exercises. This is these are the terms most women are hearing, listening to, watching during their pregnancy. So, is there any link between pelvic floor exercises? Like if you are doing pelvic floor exercises, then that may cause any kind of relationship between pelvic floor and sciatica. Pelvic floor exercises and
No.
sciatica.
Pelvic floor exercise will have no impact on sciatica if you are doing the pelvic floor exercises
Mm,
correctly. Because 60 to 70% of the times people are not doing the pelvic floor exercise properly. They are more or less contracting their abdominals, their inner thigh muscles rather than the pelvic
mm,
floor. So if they are doing it correctly, then pelvic floor contractions will not cause you sciatica. That is for sure.
Okay.
Okay. So if not healed, what could be the complications?
Sciatica, if not healed, I told you, see, you will have pain. And if the motor component is involved, then foot drop will be there. It all depends where the nerve has been impinged. See, nerve can be impinged at the canal, what we were talking. It can also be impinged in your buttocks, the thigh area where it enters the thigh. There's a small muscle called as piriformis. So if that muscle goes into spasm, you will get same sciatica-like symptoms. Once you stretch that muscle and that spasm reduces, your sciatica will be zero. So it depends where the nerve is getting compressed and what component of the nerve is getting compressed. If it is sensory, you will have pain, you will have numbness, you will have the tingling sensation, you will have that. If there is motor component, then it depends what nerve root is involved, and the nerve root supplying those muscles will get involved.
Okay. Thank you. Thank you, Dr. Yeah, Vidya.
No, I was just going to ask, well, nutrition, good, healthy diet help, I mean, for during pregnancy, for strengthening their muscles and nerves.
See, diet will definitely help. You need a overall nutritious diet, proteins, vitamins, fats, everything you need during pregnancy. But not only diet will help. Along with diet, you need to maintain proper posture, you need to exercise, you need to walk, you need a lot of, it's a like a holistic approach. Everything has to, you should be sleeping well. If you're not sleeping well, it will cause a lot of problems. You see, there are people who get neck pain because they've not slept
Right,
properly.
yeah.
So that can happen. Even during pregnancy you can get back pain. Sometimes you have a lot of gas problems pregnant females face, and a gas problem can also cause back
Okay.
pain.
Right.
So it is diet should be so such that all these areas are being touched upon. You have to exercise, you have to diet, you have to walk, you have to maintain proper posture, everything, and then you will not have any issues.
Right.
Okay. Thank you, Dr. Vidhi.
Another
There's one
question.
question over here. How will anyone come to know where the nerve is compressed?
See, that is for your ortho or the physiotherapist, whoever you are visiting, for him to diagnose. So there are a certain amount of tests what we do. First we do the test for the back, then we go on towards if there is a hip joint involvement, then we just check whether that small piriformis muscle is involved. So there are tests for each and everything. They do the tests and they get to know. And the most common test what we do is the SLR. We just raise the leg, and if the symptoms are worsening or getting better, we just get to know about that, whether it is at the back or at the hip or the buttocks or wherever. So there are tests, we do the tests and we get to know.
Okay, there were few questions on our stories as well. So one question was, can a 10-year-old sciatica pain be treated? I don't know who she asked that question for, but that was the question that we have.
Okay. See, I need to first find out 10-year-old sciatica pain is at what stage. Whether the sciatica, whatever the pain, whatever she's saying, is because of a disc problem. Is there vertebral column which has just shifted one vertebra over the other, or it is because of aging? You need to know the cause for sciatica, then you can tell whether it can be treated or not treated. See, I'm not telling 100% all the cases will be treated with physiotherapy. Some cases will need surgery. Some cases, even after surgery, do not respond well.
Right.
So I'm not scaring, but the consequences, I mean, the chances of failed surgery are very, very low. It's like around 2 or 3%.
Yeah.
And a chance of curing is more. So don't get scared. And the 10-year-old sciatica, you will have to find out what was the cause of sciatica pain. And then see, sometimes there is a lot of muscle imbalance. You have strong back muscles and a very weak abdominal muscles, or your core muscles are very weak overall. So a lot of stretching, strengthening, finding out the cause, everything is involved. And then we can tell whether that sciatica nerve pain, whatever she has, can be treated or cannot be treated. And if it can be treated, will it be treated with a conservative, like normal approach, or a surgery will be required?
Okay, thank you, Dr. Vidhi. There was one more question. It says there is some issue with her coccyx. Okay, so
Coxy.
yeah,
Coxy, I
okay,
think.
coccyx. Yeah, she's having some issue with that, and I can't see that question clearly, but maybe I'll just frame it, saying that is it something relate like if there's a pain in coccyx, will it impact the sciatica?
Okay, see, coccyx is your tailbone, the end part of your bone, and it is not hard. It is a very soft
Mm.
bone. A lot of females have that coccyx pain. You can hear me now?
Yeah,
Yeah,
now we
there
can.
was a disconnect in the between,
Repeat.
but now we can hear you.
Yeah.
Yeah. So that pain is not related to your sciatica is a nerve pain and coccyx is a bone
Mm-hmm.
pain. So these are two different things. And coccyx pain is common during pregnancy. So the way of treating that is also different.
Okay.
So the approach is different.
Okay.
Okay.
Yeah, I think that's it. Those were all pretty much all the questions. Let me just have a look if there are some more over here. Yeah, you know,
Yeah.
there were some questions, but I think we've lost them. If we've not been able to answer your questions in this live session, please feel free to drop us a DM and we will get back to you. We can forward it to Dr. Vivi and she should be able to answer your query. Yeah, I'm not able to see anything. Vidya, are you able to see any questions?
No. I scrolled, but no, not
Yeah.
able to see anything.
Yes.
Yeah, can sciatica lead to urinary incontinence? I don't know. I'm just linking the two.
See, uh, sciatica will not lead to urinary incontinence. The nerve supplying, there are a lot of nerve roots which are supplying your bladder muscles and your uh, the other muscles around your pelvic floor. So if those nerve roots are involved, then definitely you will have bladder and bowel syndrome. But that is not very common with sciatica.
Mm.
But see, at the end, what happens is when the spinal cord ends, where the nerve roots are no, at the end around L2, L3, the nerve roots are like a horse
Oh.
tail. So the nerves are just coming out like this, like this, like this. Now, which nerve roots are getting impacted?
Mm.
It will depend upon that.
Yeah.
Major sciatica problem is L2, L3, L3, L4, 5, S1 and 2. These are the nerve roots which form the
Mm.
sciatic nerve, and that sciatic nerve getting impinged is
Okay.
sciatica. But if there are S1, S2, S3, those nerve roots are involved. So there are roots which supply, these nerve roots are supplying your bowel and
Mm.
bladder, the control. So those muscles, if those nerve roots are involved, then those muscles will get weak or paralyzed. And if those are paralyzed, then you will have your incontinence and bladder incontinence, bowel incontinence symptoms.
Okay. Yeah, I went too complicated, I think. This is more to do with movement.
Yeah,
Yeah.
actually, what happens when we think a lot about, "अरे वो भी हो जाएगा, ये भी हो जाएगा," then we
Mm.
start thinking the most severe symptoms first, rather than the smaller symptoms, or what you say, mild
Yeah.
It
symptoms
is
first.
typical Google behavior, right? If you type
Yeah.
something, I have something, so you will get something so horrible that you'll be scared for the rest of your life.
Yeah.
Okay.
Yeah.
Yeah, Vidya, you have anything else? Because I
Yeah.
think I have
Yeah.
exhausted all my questions.
Last one question. Yeah. Is it common only in women? Is sciatica common only in
No, it is not. See, you can say it is more in females and less in
women? Okay.
males, but it is not like males do not get. Males also have sciatica problems. Males also come with sciatica problems. Yes, the prevalence is more in
Okay.
females
And how
because our body is built that
Mm.
way.
approximately how many
Yeah.
pregnant women, approximate percentage of pregnant women having facing this issue? Do you have any idea?
See, I have no idea about the statistics, but with my practice, I can tell. See, I have seen around antenatal and postnatal around 80, 90 cases, like the entire
Mm.
thing, antenatal as well as the postnatal, where they've continued for the entire
Mm.
period. So in that, I think 35 to 40 people had sciatica-like
Okay.
symptoms, which were mild, not very
Okay.
severe. and they were easily treatable. They just visited me once. I just taught them what they can do at home, and it was fine. Like 3 or 4 went after delivery, and they had a little issue, but post delivery, trust me, everything was fine with them. I have never had issues where they had pain even after 3 months of delivering. So none of them went till that far.
Okay. Thank
But yeah, there can be. See, one more thing, what I wanted to tell is, for pregnant females, if you want to prevent, like you don't want this thing to happen, so what you can do is maintain proper posture. You be mobile, walk, go for little mild exercises, whatever your gynac will permit. Go for exercises, go for walks, maintain proper posture. Don't stand for long, don't sit for long, because these are the things which will put more pressure. So if you just, these are the ways where you can prevent sciatica in occurring.
you. Yeah, so basically stay active.
Yeah, stay active
Okay.
Yeah.
Thank you so much.
and don't have proper good posture. That's
Yeah, posture is one like such a simple thing, but I think like most of us fail in maintaining the right posture most of the time.
yeah,
Yeah.
true.
Yeah, so it's a very simple thing, but it's very important, and it is like it's a key driving factor to so many health issues. So if you are maintaining the right posture, like majority of the issues you will never face in your life. So yeah, think about it. Yeah, and practice right posture. I'm not saying that I do it all the time. I also
Yeah.
like subconsciously get into
None
some
of us can do
weird
that.
posture, but then yeah, try to consciously think about it every now and then. Yeah, and take care. And thank you so much. Vidya, if you have any other questions, uh,
No. We are done with our questions, and thank you so much, Vidhi, for joining us. Can we do
yeah, there's one
If
question.
there are any other
There's
questions,
one,
then we can just put it
yeah,
one
in.
there's
one
just
one
one
question?
question which came up. Can we do prenatal yoga having sciatic pain?
See, it will depend upon your yoga therapist, what he or she is telling you to do. You can do exercises, but the sciatica pain has certain set of exercises which has to be done. So I don't know what yoga people do, but yes, if he is a certified person, yoga therapist, they will definitely have something for sciatica, because a lot of yoga people, they give treatment for sciatica. So they will have. Basic thing is, during sciatica, if it is very acute, you take rest. Otherwise, please move. Please do the exercises prescribed by your physio, and it will help. Resting will not help in the long
And
term.
one more thing, one basic thing, just I want to mention since this question came up, like, listen to your body. Your body is the right, your body will always guide you in the right direction. If it is paining too much, there's no point of doing any form of exercise or yoga or anything else for that matter. Okay, so listen to your body. Your body will say you when it is the time to stop. Like, your body will say, I cannot take it any further. So then stop, slow down, rest. Definitely, we have to be active. But then, if you are not able to do it, don't push yourself towards it. We have lost Dr. Vidhi.
Dr.
Okay,
Vidhi?
Vidya, do you have like because I'm her video is paused at my end.
Yeah, same here, same here.
Yeah.
We
Okay,
have
yeah. Anything we
completed.
were at the yes, we were at the end of the session. We've answered almost all the questions. Still, if you are having any further questions, feel free to drop us a message, and we will be we will be replying. We reply to all our messages. So feel free to drop us a message and take care. And thank you so